First
Not,
try.
not bad, not bad. So I think today's an important topic, overcoming the fear of bariatric surgery.
Yes.
Any thoughts or comments to start it off?
Sure. Let's start off with comparing the differences between the mini gastric bypass and the Roux-en-Y. Let's start there.
Well, the Roux-en-Y has been a surgery that's been around for a really long time, generally considered the gold standard for the longest period of time. And then the MGB came along in around 1997 and is basically a simplified version of the Roux-en-Y. It accomplishes a lot of the same results in terms of excellent weight loss, resolution of comorbidities like diabetes, high blood pressure, sleep apnea, cholesterol levels, chronic pain, etc. But done through a simplified approach in terms of bringing up a loop of bowel to the stomach, rather than having to divide the bowel and bringing one end up to the stomach, having to plug the other end to itself. All of that gets a little bit complicated. But the bottom line is it's a somewhat simplified operation with a better safety profile and complication. And I think that's one of the big fears that people have. You know, there's a number of fears that people have going into surgery.
Yes.
Interestingly, I think one of those fears is a fear of the failure of the operation, because everybody hears stories of, well, I had a friend that had this surgery and they ended up gaining all of their weight back, or they never lost the amount of weight they wanted. And I think that's the one thing that we can, kind of say pretty proudly, is that the mini-gastric bypass has an excellent weight loss profile, losing about 70 to 75% of your excess weight. And the likelihood that that weight is going to come back on, it can happen, but it's very rare, especially if you follow up with us on a regular basis. The people that tend to gain weight back are the ones that we don't hear from for years and years, that fall into bad habits without taking advantage of our free follow-up care with free support, counseling to get them back on the right track. I always prefer to have patients call me if they've gained 5 pounds rather than after they've gained 25 pounds, because it certainly makes it a lot easier. Another real big concern is the anesthesia.
Yeah.
That, especially among young mothers, that they are afraid of the anesthesia, and just the thought of being on a table, being put to sleep, and they have young children at home and they're worried. That's one of the fears I hear quite a bit. It's an easy one to reassure in terms of, I've been doing this for 22 years and we've never had anybody that died from this surgery.
Yes.
But to overcome that emotional part is a little bit harder. So the facts are, it's very safe, that it's very rare to have any kind of a major complication. Not that they never occur, but they occur very rarely. And we've never had a patient that died from having the surgery. So, I think that we can put that fear to rest, in that in over 22 years, we've never had a patient that died from this surgery.
Thank goodness. Yes.
So I think that's one that's kind of easily dispelled from a just practical, factual point of view. But the emotion of that one is sometimes hard to overcome, because young mothers will say, yeah, I know, but, even a 1 in a million risk is too much of a risk for my little children. That's kind of what we hear. But, that's the fact. The fact is we've never had anybody that didn't make it through the surgery or the next, period of time. So I think that's one that's pretty common, but easy to address. Another one that people worry about is what family and friends are going to think of them.
Yes.
I've
True.
had some patients that don't want to tell family or friends that they're having the surgery, and I get that. They don't want to hear the negativism. They don't want to hear the criticism of, oh, you're taking the easy way out, or whatever other criticisms they might hear, as unreasonable or invalid as they might be, because it's certainly not the easy way out.
No.
But nonetheless, I have found that people who do share with others might be surprised to find out that you'll get a lot of support. And maybe you'll get some naysayers, but you're going to find those people that are going to be very supportive. And those are the people that you focus on.
Yes.
And you focus on surrounding yourself with those people that are going to support you in your decision to have it. Cindy brings up a great point here, just fear of the unknown, which is why we go through so much effort to do preoperative education and make sure patients know exactly what they're getting into.
Yeah.
And so we certainly have an opportunity for those patients. We give them plenty of time to overcome that fear just by educating them on exactly how the process is going to work, what to expect on the day of surgery, the day after surgery, the week following surgery, and then, for lifetime. All of those things are easily addressed. And when, the unknown is best remedied by knowing, is best remedied by educating. So that part can be eliminated. And, I'm looking, someone saying hello there. Dale? Yeah. Hey, Dale. But I think that, worrying about what people think, you just got to focus on those that will support you.
Yes.
That's the bottom line.
And I think one of the big fears is we're giving up our best friend, which is food. And it's not like that at all.
No, not at all. Because, if we just made your stomach tiny and nothing else changed, and you were hungry for a big meal and you sat down to eat it and you took a few bites and then you couldn't eat anymore because you get sick, but yet you were still hungry and saw that big meal and you wanted it, that would be a miserable life to live.
Sure.
But one of the things that happens with the MGB is that it actually changes something in your brain in terms of the way you look at food. And this is kind of a hard one to really wrap your brain around, that
it is.
That your hunger changes. You could actually, we've had patients we've operated on right before the holidays, Thanksgiving, Christmas. And they tell me they sit around the big Thanksgiving table with everyone with their turkey and stuffing and cranberry dressing and all of the things that go along with it. And they say they enjoy themselves because while they may have a little bite of this and a little bite of that, they feel satisfied and they feel enjoyable. They enjoy the meal even with eating a little bit. And the same thing with going out to restaurants to eat with friends. You'll be able to eat whatever you want, and nobody at the table next to you is going to have any idea that you've had weight loss surgery other than maybe some of the leftovers that you're going to be bringing home. So, those are probably some of the bigger ones. For the most part, I think worrying about whether the surgery's going to work on you, right? You've tried diet and exercise for the past 10, 20, 30 years, and it works for a little while, and then it gain all your weight back, and it quits working, and you're frustrated and depressed about it all. Why would this be any different? And that's the attitude a lot of people have going into it, and they're convinced I'm the one person this is not going to work on. I know it's worked on all the other 1,000, 2,000 patients, but I'm the one it's not going to work on.
Yes.
And, you know, I just chuckle when they worry about this because I just tell them, I promise you, it's going to work for you.
I
It's going to work for you.
was
There's
one of them.
no getting around that, you know. So,
I did
hi,
not
James,
throw
no worries.
away I did not throw away my fat clothes for 6 months. It sat out in the hallway. And Henry kept finally, he said, don't you think we can take these to the, disabled vet? And I'm like, no, not yet. Not yet. But it's funny.
Well, you know, I mean, it is normal for people to have fears, like just the fear of the unknown, as Cindy said earlier. It's normal to have fears, but the challenge for you is to be willing to do what it takes to try and overcome those fears.
Yes.
And I think
And
that's
to know
the
that
big
that's
key.
normal. Yes. And to know that that's normal.
Oh, it's absolutely normal. I mean, if you weren't a little bit afraid, I would be worried that you're not taking this seriously enough.
Exactly.
So,
Yes. Now,
go
I,
ahead.
I saw James go by. He was asking me today. He was concerned about how much weight he will lose. He doesn't want to be skinny.
Yeah.
So explain to him how you determine that he will not end up skinny.
Well, one of the things we know about the mini-gastric bypass is the longer the bypass, the more weight you lose. And so one of the things that I do the day before surgery, we will sit and visit about that. And it is very common among men to be worried about losing too much weight because men don't mind being a little thicker and women. You know, the women tend to want to be thin and really get the most out of their weight loss surgery.
Yeah.
Seldom do I ever get a woman that says, I don't want to be too thin. I do get them every once in a while, but not very often. But typically the men will be, I want to get healthy, but I don't want to be skinny. And that's an easy thing to address. What I do when I visit with you the day before surgery is I ask you two questions. What is your dream weight? And what's a weight that you could live with? And after I gather that information, then I have a little formula that I plug in your height and your weight, and it calculates based on a 70% predicted weight loss, 70% of your excess weight, not your total weight, but of your excess weight, 70% of it, and it gives me a number. So let's say you tell me that, man, I would love to weigh 180 pounds. And by my predictions, you're going to weigh 180 pounds right on the money. We could do the 6-foot bypass, which is our standard, and that would get you right around there. Or if you wanted to play it safe, we could do a 5-foot bypass, which then means it's more likely that you won't quite get down to 180. You might, but you might have to really work for those last 10 or 20 pounds.
Mm-hmm.
On the other hand, if we have somebody that wants to weigh 150, but we predict they're going to weigh 180, then instead of a 6-foot bypass, maybe we do a 7-foot bypass.
Yes.
So usually it's plus or minus 2 feet one way or the other, depending on what the individual tells me is their long-term goal.
Yes. And so you will customize the bypass based on what the patient tells you.
Correct.
Yes. Well, I saw Shannon go by and she's asking, she said her father is not supportive of her having the surgery. How would you address that?
Well, the first thing I would do would be to encourage him to watch our on-demand webinar.
Yes.
Because it's an hour-long presentation and it goes through a lot of the details that he might be concerned about. And it also addresses the reality that diet and exercise has a dismal result.
Yes.
The success of diet and exercise for somebody that's 100+ pounds overweight is far less than 1% success rate.
Yes.
Even if you go to the doctor and ask the doctor to help you lose weight, putting you on diet pills and, all of this stuff has maybe a 5% success rate. And it's, long term, it's not very good. Whereas actual weight loss surgery carries with it that long-term 10-year, 20-year, 30-year lifetime assurance that the weight is going to stay off. So I think the first step for someone like her dad would be to encourage him, Dad, would you sit down and just watch this webinar with me? You can gain access to that webinar just by going to our website at mgb.surgery. No .com or anything, just mgb.surgery gets you to the website. And there's a place there where you can sign up for the on-demand webinar. And you can watch it right then and there, or you can schedule it for a future time. So I think that's an important answer to that concern.
And I think it also brings up two additional points. And one is, again, it's fear. He loves his daughter. He loves her as she is. And it's the difference also in how we feel about ourselves. Whereas, people don't understand unless they've walked in these shoes.
Right.
I was the only one in my family overweight, except for my grandparents. And so, unless you've walked in these shoes, it's hard to understand why we want that to be different.
Right.
So,
And
yes.
it's a lot harder, if her father is of a normal weight,
Yes.
then that makes the convincing even harder. And I'm certainly willing to have a conversation with your father.
Yes.
If y'all live close enough to come by the office, I'll sit down and have a conversation with him. If it's something we need to do with a phone call or a Zoom call, we can do that so that I can answer any questions that a family member might have, the objections that they have, and just answer the questions as honestly as I possibly can, And we've done that on a number of occasions, and it really has a high success rate. Just talking and educating them and making them recognize this is not just an easy way out. This is not the lazy person's way to lose weight. This is a courageous and significant decision that is made based on all of the evidence that shows the superiority of weight loss surgery like the mini-gastric bypass to help people achieve the weight loss goals that they're more than likely never going to achieve despite all of their desires. And
Yes.
reality is it's just not going to happen.
Yes. Well, she just said he's of normal weight.
Right.
She just made the comment. So, and Shannon understand, my dad was the same way. And every time I went to visit, he gave me a can of Slim Fast. And he bought me 3 stationary bicycles at garage sales in case I needed parts. And it hurt. I would leave and I would tell Henry, just go get me a donut. That hurts. And it's, again, I've come to understand it's because he loves me.
Yeah.
And doesn't know what it's like to walk in those shoes. So that is tough. Yes,
right.
Very. Okay, another fear that we have is, what are we going to look like after surgery? What about the loose skin? What about all of that?
Yeah. One of the things that I've noticed is that your face All right, well, I'm not sure what happened. I was in the middle of a Facebook Live, and suddenly it just booted me off and said something went wrong, and they cut me out. So I just, rather than having it end abruptly, I wanted to just close out by letting you know whatever fears you might have, whether it be the fear of what family and friends are going to talk about, the fear of the unknown, the fear of complications, the fear of adequate weight loss, much loss. All of these things we can deal with. I would just encourage you to communicate with us. Hey, Carla. So it just booted me off, so I figured
Me
we'd get
too.
back on to give a little bit of a closing remark so that it didn't seem like we just abruptly ended. Um,
I didn't really go get a donut.
yeah. So I was just summarizing all the different fears, and the best way to overcome those fears, talk to you, talk to me. Call us. I'm available by phone if anybody needs some reassurance or explanation or education. And I also strongly encourage people to check out our online webinar, because I think it's a very informative and powerful little. It's an hour well spent just listening to the explanations that we have. Been doing this for 22 years. We've had great results. We've never had a death in 22 years. And I just, I encourage everybody to check that out. You can find it at our website, which is mgb.surgery, or our old website, mgb-surgery.com. They'll both lead to the same place. mgb.surgery is a little bit simpler to remember. But I hope everybody will check that out, and anybody with any concerns. My goal is not to talk you into anything. I never want to talk you into having something that you have reservations about. But what I would like to do is educate you to make sure that the concerns that you have are addressed appropriately, and then the rest is totally up to you.
Yeah.
So and one of the things that we do to help people overcome that fear, of course they don't get to do it until after they've stated they want to have the surgery, is we put them in touch with other patients that have had the surgery. And one of the things this Facebook page is good for is, people that are thinking about having the surgery. If they express their concerns right here on this Facebook website, they'll get patients of ours that will respond and invite them to talk to them personally or share their own personal experience. So, Rhonda, I appreciate you giving those good words there. Maybe that'll help somebody.
Yes. And our private Facebook page now has 985 patients only on it. It is incredible.
That's great.
Absolutely incredible. Yes. And they can always call me. Call me at 314-807-7110. I'm happy to help you.
Perfect.
You can find the courage to become happy and healthy.
Yeah, that one of the biggest ways to overcome the fear is to think about, do you fear not having the surgery?
Yes.
Where are you going to be 10, 15, 20 years from now in your life? With the increased risk of stroke and heart attack, the diminished mobility that you're going to have, the chronic pain, the development of comorbidities as you age. All of these things are fears that you should be having. And I agree, Rhonda. Carla is the best. And,
thank you.
And we just love you, and you're great at what you do. So all of these things, all of these fears of not having the surgery need to be plugged into that equation also.
Yeah.
All right. Well, go ahead.
When you find you're adapting your life to the pain that the weight is bringing, that's when you need to step back and really look at it. And if we could just allow them to have all that weight gone for 1 hour and feel what that is like, it is absolutely amazing life change. I still absolutely can't believe it sometimes. It's like, oh my gosh, great.
And this is your anniversary month, 22 years?
22 years. I lost 159 pounds. Oh my word. I used to weigh 320.
Yeah.
Woo! Yay.
That's
Yay.
awesome. All right.
Awesome.
Well, listen, you have a wonderful rest of the day. And, well, you want to give out your phone number one more time in case anybody wants to give you a call?
Sure. 314-807-7110. Love you. Thank you, everyone.
Thanks, Carla.
Bye.